We're out there on Facebook. Hey, good morning, Facebook crowd.
I'd like to introduce you to Dr. Stephen Holt, the director of the VA North Texas, second largest VA in the United States, right, Dr. Holt?
That's correct.
And probably the best.
We'd like to be. If we're not, we're going to work hard to be.
Which is actually a great story, because when my friend Jeff Milligan first took over, your predecessor, the Dallas VA was down there with the Phoenix VA, was one of the worst. And to me, that is a great testament to personal leadership, because every VA basically has pretty much the same resource. I realize it's a little bit different, but they have the same resources. And Dr. Milligan has helped really turn it around. I know that you have done a pretty incredible job of continuing that mission, and sometimes that is a challenge. You've continued to make the Dallas VA better and better, and for all of our veterans in North Texas, we appreciate that.
Well, I trained under Jeff Milligan. So.
Yeah. You were part of that staff. One of the things a lot of people don't realize is you are an Air Force medical doctor. You were an MD. So you were an MD, an administrator. There are only, I think, 2 or 3 MDs that are administrators in the whole VA system. Is that correct?
Well, actually, when I became one, there were only 3. They're now about 20% of the 147 are physicians, and that really changed, only in the last 8 years or so.
All right, guys, we're about ready to start recording for regular radio. So and Nathaniel, are you ready to go right at the 9:30 mark?
I'll hit it like this.
Okay. You want to just... Across America, you're listening to the Veterans Impact Show.
And Jim, on the picture, only half of you is showing up.
Yeah, I'm trying to get Nathaniel to push the camera back.
Okay, I lost the intro.
Okay, we're gonna go.
All right, we're going to start the intro again. Across America, you're listening to the Veterans Impact Show, featuring stories of veterans who continue the mission in their communities with honor, courage, and commitment. Brought to you by Fairway Independent Mortgage Corporation and the Texas Veterans Chamber of Commerce. Good morning. This is Jim Blythe, U.S. Navy veteran. Joining me, my co-host and inspiration for perspiration, U.S. Marine Chuck Wright. Welcome aboard, brother.
Hey, it's great to be here as always. A wonderful Saturday morning from downtown Frisco, Texas.
It doesn't get any better than this. And I'd like to say thank you to my wife, Diane, for putting us on Facebook, and for Nathaniel for engineering this and making it all happen. You remember, if you want technology, get somebody young, because us old guys just don't do well. No. All right, this morning, I've got a very good friend who is an amazing human being. I want to introduce you to Dr. Stephen Holt, who is the director of the North Texas VA. Dr. Holt, welcome aboard.
Thanks. Good to be back. Thanks so much for having me.
You always bring so much to the table, and just for a quick background, you are a medical doctor, an administrator. You are the director of the North Texas VA, which is the second largest VA healthcare facility in the United States, 40 counties, facilities throughout that area. You worked under Jeff Milligan a number of years ago. You went up to Illinois, then you came back to be our director. And you and Jeff Milligan have made so many wonderful changes that we're now, I think in the surveys I've seen, as good, if not better, than many civilian hospitals. And we are probably the top performing hospital in the VA.
We're definitely one of them. And again, as you said, a lot of credit goes to Jeff Milligan, who really set the stage, and he actually selected the executive team that I get to field.
All right, one of the most important things that you and I have talked about, and Chuck and I talked about a couple of weeks ago, for our Afghan and our Iraq veterans, there is a burn pit registry, and that was a serious problem of the burn pits with all the toxic things that were being burned. And so one of the things that we want people to know, okay, if you were in Iraq or Afghanistan or some of these other places that had these burn pits, there is a registry, and Dr. Holt, tell us a little bit about what is going on with that and kind of be able to guide people to get to the VA and understand and help out and get medical help if they need it.
Sure. So this registry, bottom line up front, this is a attempt to collect all the names and be able to monitor the health data of all the people who may have been exposed to burn pits stationed in Southwest Asia, okay, which also includes Kuwait and the Emirates and Saudi Arabia, et cetera. So it's a very important thing. Now, entering into this registry makes you known so that if we find certain things happen, if we find certain diseases associated with possible exposures, then we can find you quickly as opposed to you finding us and making you aware of the benefits and adjustments potentially to your disability ratings. So, and let me say, this has absolutely no adverse effect on your VA eligibility, your VA benefits, and future compensation claims. This is purely a way of getting what is this cohort, and also allow us to launch some scientific studies to find out what things, particularly the rare things. So if you look at Agent Orange, it took us many years to figure out the different things associated with Agent Orange. And it was many years looking at many people to find those more rare cancers and things like bladder cancer, so that we can now say, hey, this is connected. You don't have to, all you have to do is show you were exposed to Agent Orange, which means all you have to do is prove you spent 1 day in country in Vietnam. That's it. We presume you were exposed. You don't have to say, hey, I worked on the airline, or I, the airfield, or I was on these planes, or I was under the plane when it dropped. None of that. And if you develop bladder cancer, it's automatically connected to Agent Orange. All you have to do is, say, look, I got bladder cancer now, boom. The rest, goes automatic. You don't have to prove anything else. So this registry is very important. It gives us that collection of people, that cohort, so we can study and look for those health effects, and particularly the ones that might be less, that might be more rare. So it's important to register.
Well, and that exactly was my question, Dr. Holt. What I wanted to ask you, how does the burn pit registry differ from registering just with the VA?
Because it identifies you as exposed to burn pit. Unless you identify yourself as exposed, we don't know.
Okay.
We simply don't know.
So you're not, the VA doesn't have the capability to drill into people's records. We basically are asking people to register twice, which is fine.
Exactly.
Not a big deal, but we're looking for something specific.
Yeah, because exactly. I think you hit it on the head. And so we don't know what your exposures are. We only know what's on your DD-214 and what you put in your claim.
Okay.
So if you didn't put this in your claim, and so the registry allows us to collect all those people, and as benefits evolve, we can get them to you without you missing those.
Dr. Holt, one of the questions that I would have along the line of what Chuck was saying, what if you are not signed up for the VA, but you are an Iraq and Afghanistan or a Middle Eastern veteran? Can you sign up for the burn pit registry? And if you want to down the road, you can sign up for the VA benefits, but you don't have to necessarily be in the benefits category. You can go ahead and sign up for this. Is that correct?
Absolutely. And you go to you could Google it. It's probably the easy way, and put VA burn pit registry, and it'll come up, and it'll take you to the website, which is the publichealth.va.gov, and all the directions are on there, including the link to the form that you fill out to sign up for the registry.
All right, man, that's fantastic that everybody needs to know. All right, with that being said, you have had some very important visitors over the last few weeks.
Yeah, Tours R Us.
I tried to call you up one day and say, hey, let's go grab a bite of lunch. And I think your secretary, you said, I'm meeting with the president. So you actually had President Biden come to Fort Worth to one of your clinics there. That was quite a big deal. Yeah,
he and the secretary came, and then earlier this week, we had the chief of staff, like the number 3 person of the VA, come and had the opportunity to have dinner with her and discuss veteran issues and things. So yeah, we President Biden came down, toured my Fort Worth clinic, and then went just a short distance away to make his announcement on burn pits, and had the opportunity to educate him a lot on America's healthcare system, of which he is ultimately the chief executive over it. And VA is America's healthcare system, whether you're a veteran or just a veteran to be, namely active duty, or somebody who'll serve, or a citizen, taxpayer. This is your health system. You're paying for it. Ultimately, you get to demand the standards and performance of the system through Congress, and we're here to serve.
Excuse me, Chuck. Dr. Holt, real quick, I want to make one point that I learned over the years working with you and the VA. Our VA health care system really leads the nation in a lot of new things. 70% of all medical professionals train in the VA. Did you know that, Chuck?
It was exactly the question that I was going to ask.
And basically,
Jim and I are tracking this morning.
And so when you take a look at what goes on in the VA, what goes on with veterans, it's very documentable to say that the VA leads the way, without a doubt, in our national health care system as well.
Yeah, no, and absolutely. And I'm going to tell you, Susan Collins wrote a great book about the VA. I think she published it in 2016. She works out University of Stanford. And in that book, she cites that in 2016, actually, VA published over 11,000 medical articles, peer-reviewed medical articles, which is more than the next 5 medical entities in the country combined. And right now, the VA has initiated over 50 medical studies just looking at burn pit exposures. So we lead the way in research. We are a major academic educational powerhouse for the nation. And we did so much, in emergency response during COVID, not to mention other disasters, but COVID in particular, to augment other government agencies and local healthcare agencies during the peaks of COVID.
A lot of people don't know that you have so many people on your staff who are also academic and leaders, like UT Southwestern. Dr. Hastings, who's your chief of staff here, is also on the staff of UT Southwestern. You asked me, or somebody asked me from the VA to talk with your director in Houston, and he was talking about the alliances they have with the DeBakey Center there at, as well as with MD Anderson. So this is true around the United States. VA interacts and combines its forces with major medical centers.
Yeah, no, and that's the model for VA to be partnered with, affiliated with major private academic centers wherever we can be. And then we serve as a training platform because we have a unique patient population. And also because we're not for profit, we can take a little bit more time teaching. Like, so in surgery, for instance, we can take longer to do a surgical case, to teach a surgical resident, than a for-profit, which has to really dependent on turning cases fast. So that's one of the benefits to the affiliates, that we can serve as a major training ground.
I think a lot of people now feel like, for instance, COVID. Let's change the track a little bit. A lot of people are getting very complacent. We think, okay, COVID's over with. There's another variant coming up. But you guys' response to COVID, I think, was really amazing in helping the veterans. Tell us a little bit about that.
Yeah, well, let me sidetrack for just a second, just to put COVID in perspective. I pulled numbers earlier this week. We are about 18,000 deaths short of 1 million Americans dying from COVID. And let me put that into perspective. If you take our 2 bloodiest wars, the Civil War and World War II, only 1,025,000 people died total. So we are less than 40,000 short of the number of Americans dying that died in our combined two bloodiest wars in history. that's pretty serious. And when you put it against the flu, because a lot of people, it's just the flu, right? Well, we only have between 20 and 50,000 people a year die from flu. So we're a little over 2 years into COVID and almost 1 million. So think about that. More than 10 times the death rate. So, yeah, we did a lot. I mean, we set up immunizations throughout the area. We supported other agencies in immunizations. We gave immunizations to the family members of veterans who are eligible for care to further protect our veterans. And we also opened up the Garland VA Medical Center. We could have taken up to 210 overflow COVID patients over there, which expanded the DFW area total emergency capacity by 21%, because the other place was 1,000 cots on the floor of the convention center, the K. Bailey Hutchinson. These were actual hospital rooms we opened up. So the VA as a whole throughout the nation has been providing these services, has providing vaccination, has been taking humanitarian admissions when possible, and doing these sort of services to help the community, particularly in places like San Antonio that got very, very hard hit. Dallas got hard hit. And in fact, from December to mid-February, my hospital had the greatest number of COVID inpatients of any VA facility in the nation. And fortunately, it has dropped way off from 140 some down to about 5 or 6 a day right now, but it was bad.
You know, one of the things, too, that I happen to know because you sent me a document is the VA research. You launched more than 50 new studies on COVID-19 between January and July 2021, involving more than 40 VA medical centers and building on that COVID research. I think this is not only important, but this is research that if we ever have another pandemic, we're going to be able to take care of it. So I'll tell you what, we're about to go to a commercial break and hear from all of our partners. So this is Jim Blythe and Chuck Wright with Dr. Stephen Holt, the director of the VA North Texas. We're going to be right back after this word from all of our partners. Thank you for being with us on your Veterans Impact Show. We'll be right back. All right, welcome back. This is Jim Blythe with Chuck Wright. We've got Dr. Stephen Holt, the director of the North Texas VA. Dr. Holt, you were going to make a comment about COVID, and I had to cut you off for the commercials.
He's rude that way.
Yes, I know. Oh, we're still on the break.
Okay. But we are on Facebook Live, so let's keep our Facebook listeners
exactly
as opposed to dead air.
Yes.
One never wants dead air.
I told you this is our second time in the studio, and we're learning.
Yeah,
so let's go back to that comment you made.
Yeah, you said if we have another pandemic. I think there's absolutely no question we'll have another pandemic. There's a great book written called The Pandemic Century, and it starts with the pandemic of 1917 to 1921, the Spanish flu. And pretty much on average, about every 10 years, we have a major pandemic. And it's, there's no question, particularly how interconnected the world is with the ability to travel literally anywhere in the world in less than 24 hours and bring the disease with you, that we will have another pandemic.
I don't think there's any doubt about that at all. As our world becomes, as they say, smaller and smaller and smaller all the time. And unfortunately, and I'm not going to ask you the question I really want to ask because we've all read the research, but I won't formally ask you to go on the record that this was man-created. So you don't have to answer that one.
I'm not going to answer that, but I'm going to say there's a joke within the virologist community that's kind of gotten stifled. And the joke was, that yes, this virus made the leap from animal to man, and it did it through humanized mice. And humanized mice are mice that have been genetically modified to have a respiratory tract similar to people. Now, that's the joke among the experts.
That was a very politically correct way to answer my silliness.
That ain't funny, but
yeah, it is. It's hilarious. We're all laughing at it.
All right. Well, we're going to go back to our terrestrial radio programming in just a few seconds. So Facebook, thank you for joining us. Send us a message. Share us on YouTube. And we'll be back on the terrestrial radio in 3 seconds. Across America, you're listening to the Veterans Impact Show, featuring stories of veterans who continue the mission in their communities with honor, courage, and commitment. Brought to you by Fairway Independent Mortgage Corporation and the Texas Veterans Chamber of Commerce. All right, we're back with you with Dr. Stephen Holt, the director of the VA. And I want to say a special thank you to our South Texas affiliates, our other affiliates across the nation that join in. We really appreciate it. Again, go to YouTube, go to Facebook, join us, like us, be a part of this, and let's get out there and get more people. Dr. Holt, we were talking about COVID on the Facebook. Let's repeat what you said about the when I said the wrong statement about the pandemic being.
Yeah. So, and it wasn't the wrong statement. It was a great statement. It says if we have another pandemic, and my feeling is we will definitely have another pandemic, and I base that on a lot of research. But there's a very good book called The Pandemic Century, and it tracks every pandemic starting with the 1917 to 1921 Spanish flu. And pretty much about every 10 years, we have a pandemic. And given how you can travel anywhere in the world within 24 hours and take a disease with you, even Ebola, because the time it takes from when you get infected to the time you manifest symptoms and you're exposing people in the meantime, guess what? It's going to happen again. I have little doubt in my mind that we're going to be doing this over and over. Hopefully they won't be as severe as the 1917 and COVID, but.
So Dr. Holt, one of the things you talked about, and one of the things that, as we talked about in the first segment of the show, the VA does some incredible training and some incredible research. What have we learned, besides the fact that shutting down the entire nation doesn't work? Sorry, I guess that was a bit of a political statement. But what have we learned that, in your eyes, what have we learned from COVID that we can help make the next pandemic easier to deal with, faster to deal with? And I'm not 100% certain how to say that, but I think you know where I'm trying to go. Can you talk a little bit about how this has, as every crisis does, it expands our knowledge? Can you talk a little bit from a medical perspective, how this has expanded our knowledge?
Yeah, so I'm going to take it a little bit off the medical track for just a second, because I went to the number 2 war college in the country, which is a logistics college, and studying with distinguished graduate. And the reason I bring this up is I think a very important lesson that we cannot lose is when we start to get into one of these things, and as we begin to mobilize public health and public sentiment, our supply chains are so vulnerable. So because we have these supply chains that are very lean, that are just-in-time supply chains that are so sensitive to disruption. Now, it's great for business. It's very, it cuts costs and everything. But if we want to weather these things, we really got to look at our supply chains when we start at the front end and make sure at that time we start to build in the redundancy. So we don't have shortnesses of masks and gloves and gowns just on the medical side, coming back to medical, not to mention toilet paper, right?
Right.
That is something that we've got to look at, that critical infrastructure and how we ramp it up in the face of one of these emerging disasters. Now, the second thing we've learned is you got to take it seriously up front, and you got to be aggressive. You can't step into it because these diseases spread like wildfire. And the quicker you stamp it out, the better. And I don't know how you deal with the level of conspiracy theories and disbelief. We've somehow got to get better to be more trusted agents of the information, because there's so much distrust out there and I think thousands of people died as a product of misinformation and not getting
sadly
vaccinated.
such a true statement.
Dr. Holt, I lost my cousin, and he was like my brother. We grew up together. We were both only children. And I talked to him on a Thursday, and I said, Mickey, man, you sound terrible. And he said, yeah, I got this cold, and I can't seem to get rid of it. I got a call on Monday that he was gone, and he had COVID, and he never got a vaccination. Every time I talked to him, he was like, it's conspiracy. I'm not going to do that. It killed him. And
Well,
I
and
know a bunch that have.
We talked about Jeff Milligan, my former boss, the guy who I replaced here as the director. He got a call. His brother came down with COVID, and 36 hours later, his brother was dead. And so, that whole public trust, I haven't looked at the trust numbers recently, but the military used to be the number one trusted agent with about 78%. So
I'll tell you what, let's do. We're going to have to, again, take our break and finish up. I want to say thank you so much for being on board, Dr. Holt. If people want to get a hold of you, just go to the VA and send a message to the VA North Texas. Thank you for being a part of our team here on the Veterans Impact Show. And thank you. And I owe you a lunch. Let's do that.
You bet.
All right. Thank you again, Dr. Holt. So we're going to take a break now, and we'll be right back after these words.
Thank you, sir. We appreciate you being on.
Okay, you guys have a good one.
You too.
Hey, everybody out there on Facebook, we're trying to take care of some stuff. We've moved into a new studio, so bear with us a little bit as we get the zigs and the zags figured out. It will continue to get smoother and smoother every week. We are about to jump over. We've been talking to Dr. Stephen Holt, who runs the Texas VA, and now we're about to jump over and talk about the Army Scholarship Fund.
Okay, can we plug
So that's going to be
Galt?
very interesting. I don't know how many of you are like me, who has a son that's a senior in high school, or I say son, daughter, or juniors and sophomores, but this is certainly the type of information that you want to have. If you've got a niece or a nephew, if you've got a friend's kid, this is going to be a segment you're going to want to be listening to. And I'm kind of doing my soft shoe and vamping a little bit as we're getting set up. We are on commercial from terrestrial radio. We do both Facebook broadcast and we do terrestrial radio broadcasts, where we are covered all across the nation, especially in areas like South Texas and in California, but we're out on the USA Network. A little shout out for them, and I'm going to figure out what our South Texas network is called.
The No Bull Network.
The No Bull Network.
No kidding.
I like that. The No Bull Network.
And then in Northern California is AUN, and they're a TV network. They carry us on about 11 stations out there. In
So
South
they
Texas.
there's a demand for two ugly guys talking on the radio.
Yeah.
Yeah, I was going to
And
say
Chuck,
that was.
I got to tell you, I was so surprised we got picked up in California on TV stations. And so they're playing this, what we send them. And I got a call from Ray Mason, General Ray Mason, who is the head of Army Emergency Relief. And he said, my sister called me and watched me on TV. And I'm like, what?
Yeah, it's just amazing what the reach is as we continue to try to grow. We continue to get information out. So it's one thing I'm going to share with our
Okay.
Facebook.
Do we? All right, let me change a second. Nathaniel, we don't have Jeff Galt on yet? Yeah.
Okay, so we're working on our second half of the show guest. We're not sure where he is. That happens sometimes, but one of the things that I wanted to kind of mention, and it was one of the things that Dr. Holt mentioned
Colonel Galt.
in his.
We're ready to plug you in on Zoom. Have you tried to open that? Oh, no.
Can we call him in?
All right, he's going to connect the phone to this, so just stay
Yeah,
with us
let's
right there.
everybody hang for just a second. We won't be able to see his smiling face, but we will be able to hear his shiny voice.
Okay.
Talking about the Army Scholarship Fund. But while we're talking about it, you were talking about General Mason and the Army's. Is it the Army or the government's?
No, it's
emergency
Army
preparedness.
emergency relief.
Emergency relief.
Okay, so each branch, Army emergency relief, Navy and Marine Corps emergency relief, Air Force and Coast Guard has one, and basically they provide funds, grants, etc.
So this is more a
counseling.
service to our veterans. So, and what's interesting
No, they
about
do that as well.
is
As well as active duty.
I was just in a conversation this past week where we're broadcasting from Frisco and was visiting with our city leaders, connecting them to some of our church leaders to put together a better plan for emergency relief. And I sit on the One Star board in Texas, and one of its charges is to support grants for emergency relief.
All right, now we're right there in 10 seconds. Let's go to our terrestrial radio.